So we're going to do another injection. This time we're going to use Botox. We actually just did a lip injection on her, and you can find the video online. What I'm going to talk about is Botox for prevention. I keep saying this over and over again because the company doesn't advertise this. It's not part of the FDA clearance. The ads don't talk about it, but really Botox works much better for prevention. If you wait till you're in your 50s and 60s and 70s, the results are more limited. Once you've already formed static lines or permanent wrinkles inside the skin of the forehead around the eyes, Botox will have a more limited benefit. Doesn't mean you shouldn't do it. It's still good, but not as good as if you start young. So what we're going to start with is working on softening some expression lines, but not completely wiping them out. We don't want to be frozen, we don't want to be droopy, we don't want to look artificial, but we just want to look refreshed and prevent lines from ever forming. If we look at this woman's face, you can see it's a beautiful face. You look at her, 9 out of 10 people would say, Botox, why are you doing Botox? But the important thing is, I'm going to have her frown at me, get mad, kind of frown, see these lines are forming, frown again a little bit and hold it. And you can see that if you let it go, the 11 marks are going to start forming. And once they form, if the skin is not completely pale, it's not a Northern European face where you could really laser it, anybody else of Asian or Middle Eastern or ethnic skin type, what's going to happen is we don't have laser options that are going to be that effective. So Botox is very effective. It's a small dose. We're going to do it 3 times a year and maintain her. So I'm going to inject Botox at a central part here, which will also give her a little bit of a lift. As the eyebrows go up, I think it fits her face nicer. Some people like more of a flat arch, some people like more of an arch, and that's what we're going to maintain. The other thing is around the eyes. Prevention of crow's feet around the eyes is really important because as you smile, what happens is, go ahead and big smile for me, you see the brow pulls down. And if you inject this area, the brow maintains more of an arch and the eyes stay more open. They look nicer. Now some people tend to squint with their eyes and they really smile with their eyes. They may not be crazy about getting Botox, but most people like the look of it, like the benefit of it. If it's done properly, you're going to like it. If it's done improperly, you're going to get scared. So make sure you go into a place that does it properly. So let's do the technique now. Alright, so we're going to start with the central glabella. What I do is I inject the procerus right in the middle. That's a muscle that creates transverse lines. I'm going to prevent those from forming. I inject the depressor of the head of the brow, and if you notice, if you're really good, you can notice that her left eyebrow is a little bit higher than the right. Most people are not perfectly symmetric. These are natural parts of the human face. You just want to recognize it. Sometimes you can improve it. You definitely don't want to make it worse. So injecting the central glabella, injecting the corrugator. We'll do a little bit differently on this side. To again try to give her more symmetry. There's a bleeding point, just hold a little pressure to prevent a bruise from forming. I'm going to do this one a little bit more centrally. The other side's a little bit more laterally. What that does is it allows this right side to come up a little bit more. Then we're going to do a little bit to the central part of the forehead. Not too much, because we want to give her an arch. If you paralyze the frontalis, she won't have an arch. That's it. This is 15 units for a central glabella. Now we're going to do the crow's feet. So for the crow's feet, I'm going to start lateral canthus, create a bleb, take the eyebrow, pull it up, inject under it, get a lift, go to the lower part of the auricularis. Now I'm going to have her open her eyes and look up at the ceiling. I'm going to inject right under the eye. This is a very advanced technique. Most people don't do that, but that helps with lines down there. I'm going to repeat it on this side. You can close your eyes right now. Lateral canthus. Take the brow, pull it up. Inject under it. And again, most people stop here. Look up for me again. Now, I have a little bit extra. I'm going to go back. Just split it half and half between the two crow's feet. That's it. The little bumps are essentially Botox underneath the skin. They'll go away in about 20 minutes. There's no bleeding, there's no bruising. There can be. Anytime you put a needle in the skin, there could be a bruise. But this time, we got lucky. There's no bruises. If you have good technique, use a small needle, don't jab it in there. The chances of bruising becomes less. Looks fantastic. She can, in 20 minutes or so, go out, go about her business. Takes about 2 weeks for it to start working. Sometimes you see something sooner, but give it the full 2 weeks for the effects and then repeat it in 3 or 4 months. Thanks. Thank you.